I'm Dan Dolnikowski from Advanced Rehab Technologies. We've been doing business for over 32 years and have helped over 10,000 patients with lymphedema. Today I'm going to be demonstrating the proper use of the Biocompression 2004 DL pump. We're going to show both use of an arm sleeve and a leg boot. Now, anytime you're going to go into one of these things, it's important that you be covered. Your limb needs to be covered because the boots are vinyl, they do not breathe, and hence you're going to perspire a lot, and the sleeve or the boot becomes very dirty. So what I have here are two simple pillowcases, and we are going to put these on the limbs. Just lift the leg up there, thank you, dear. Assisted by my lovely spokesmodel, my wife, Marites. We're going to put something on the arm as well, so all her bare skin is covered. Now we're going to start with the sleeve. The arm sleeve here, notice, is cut at an angle. So this part here, the high part goes on the shoulder. We're going to open this up and we'll have her slide in. It's important that you never pull these things up by yanking on the hoses themselves. They are in there, but not in there enough that you can't pull them out, and if you do, that is a catastrophic failure. And here we're going to unzip the boot. See, it's all vinyl on the inside, which is why we wear the pillowcase. Or pajamas, sweats, pair of socks. Now this one has straps on the side, so we're just going to pull it up, make sure her heel's firmly in the bottom. Now she's ready to go. Now the pump here has a bunch of buttons on it. For patients, we tell them the one you want to worry about is the green button right here. Everything else is not that important for you. Just leave them alone, please. So just press the button, hold it firmly for 3 to 4 seconds, and the machine turns on. This one's set to 40 millimeters of mercury, 90-second inflation, and has a timer set for 1 hour. At this point now, it's all going to start working for her. It'll start pumping air, and she'll be ready to go. Now, I do warn patients it's important when you're going to do this, take care of business before you sit down. Especially if you're taking, say, Lasix or hydrochlorothiazide, that tends to make you want to go to the bathroom a lot. I often suggest to people that if you're taking these pills, take them, but delay them 1 hour so you can get this done first, because when they kick in, it's really hard to get out of this thing quickly, and we don't want you to have an accident. Now, when you do sit down, I tell people a lot of times, make sure you get everything you need when you're sitting down, because there's no getting up and moving around once you start. So, you got the TV remote, cell phone, a drink, something to eat, crossword puzzle, whatever it is, make sure it's sitting next to you because you cannot get up and move at all with this. Now, this thing is slowly filling up, so at this point, the patient just needs to sit back and relax for an hour, and it's going to do its job. Now, when I see somebody for the very first time, I often recommend they do 4 things total in order to get better. Number 1 is the pump. Initially, when we first start somebody, I like to do an hour session 2 times per day, morning and evening, and I'll explain why in a minute. So you're going to sit down here, let the machine run for an hour, then it will turn itself off, and then you just simply slide out and get out. If you do need to get out in a hurry, please wait for the machine to be in a deflation cycle. It makes it a lot easier to get out. So that way it'll deflate here after 1.5 minutes, and then you can simply press the stop button, the green button, slide out everything and go about your business. No need to worry about restarting and making up 20-30 minutes. The timer does reset for an hour when you turn it off manually. So that's thing number 1, the pump. Down the road, after a month or 2, you're the best judge of how it's working. If the limb looks like it's down and you just want to do 1 time a day, that's great. That'll help maintain your limb at the new smaller size and keep the blood flow and the edema flow up and out of the limb, and that's a good thing for you. Thing number 2, elevation. We definitely recommend you elevate as much as you can. Here, having the legs up in the chair is good. Here, taking another pillow, maybe putting it under the arm is also a good thing. But have the arm up and the leg up. Especially when you sleep at night, we also recommend elevation. Now you can do this in a couple different ways. One, go to Amazon, eBay, Walmart, local pharmacy that makes a foam wedge. It's a dense foam, V-shaped. Put that under your leg at night while you sleep, and that brings the leg up a couple inches. Or take a standard 2x4. You don't need an 8-foot chunk here. You need literally just a square. Cut one of those off, lift up the foot of the bed, slide it underneath, and now your bed is up 2 inches. Now, keep in mind what I'm saying here. I want to go from perfect horizontal in bed to this. No one says we want you to go from this to this. I don't want you getting dizzy in bed, getting acid reflux. Just 2 inches, that will bring the limb down while you sleep at night. So that's number 2 thing I recommend, elevation. Number 3 thing, compression socks. Now, a lot of people have compression socks, and there's many different types of compression garments. However, we do recommend they not be underneath the boot or the arm sleeve when you're using the pump. Some doctors feel it's just a bit too much. So the thing to do is do this first thing in the morning before you put your compression garments on. When you do this, the limb will get smaller, and hence the garments going up your arm or leg should be a lot easier. Wear the compression garments all day, and then for your nighttime session, wait till about an hour before you go to bed, take the compression garment off, slide the sleeves on, pump for an hour, and then go to bed once again with your feet slightly elevated. Now, compression garments, you can do things like Tubigrip. You can do compression socks, like what are known as TEDs. They're very light compression, but they're compression. You can get from the doctor's script and get a Juzo, Jote, Sigvar type stocking, 20 to 30 millimeters typically. They work good. Get them at your local pharmacy or durable medical equipment supplier. Or there are things called Circades, which will be a separate video where we can put this thing on you that has Velcro, and you bring it around your leg and Velcro, Velcro, Velcro. And that helps keep the limb down when you're walking around all day. So that's thing number 3. It helps keep the limb down and allows you to keep the gains you make on the pump. Thing number 4 that I highly recommend for everybody is exercise. You want to get up and move. Now, why? Well, everybody here watching this video has what's called a calf muscle pump in their limb. Sitting in a chair, lying in bed, that muscle is doing nothing for you. But when you're walking, climbing stairs, just taking a stroll, it's flexing and it's helping to pump the blood and the edema up out of your legs, and that's a good thing for you. That helps immensely. The second thing it does is it keeps you mobile. We have been doing this now for 32 years. I get calls all the time for service. Typically these calls come in saying, Dan, my pump isn't working. And I'm like, oh, I'm so sorry. All right, listen, I have time to come and see you on Thursday. Let me come down and take a look at it. I'll bring a loaner pump. We'll get it all figured out for you. And they're like, that's great, Dan. Oh, by the way, though, I'm not at home where you set me up. And I'm like, okay, where are you then? And they're like, I'm at the skilled nursing facility up the highway. I'm like, why are you there? And they're like, I fell down and I broke my hip, and they're very unhappy. So I go there, and what do I find is the thing's been broken because somebody, not the patient, has dropped it on the floor. We've had cases where they've crushed it under a 2,000-pound hospital bed. I've had a couple of cases where they just completely lost the pump by moving the patient from one part of the facility to another. Either way, they needed a pump replaced or repaired. We do this. But the patients I talk to in these facilities are not happy. They don't want to be there. So I tell people the way to avoid this is get up and start moving now. Mind you, no one here is suggesting you're going to go run a marathon. No one's suggesting you're going mountain climbing. Nice, leisurely walks to the best of your ability is all I want you to try to do. So those are the 4 things we want you to do to get better with the lymphedema compression pump. Now, let's talk quickly about maintenance, all right? Thing with the pump, put it on something solid. Nothing that's going to fall down and cause the pump to break. TV trays, big fat no. Nice solid table, wood or metal, whatever, make sure it's there. I don't recommend putting it on the floor because I've had a lot of problems with people trying to reach the controls and they ended up touching all the wrong buttons. So put it within arm's reach that you can see it and use it. Now, maintenance on the pump, you have to dust it. Take a rag and go boom, 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 and that's all it really requires. The boots here, however, are a different issue. Once again, we put you in a pillowcase or something else wearing long slacks, pajamas, a nice long sock, because we don't want skin contact in the boot. They tend to get dirty. This is especially important if you have open wounds. You want to make sure your leg's covered because if the wound oozes into the boot, it will make a stain and then that thing smells ungodly after a while. The other problem there is when the boot gets really dirty and say you don't cover your leg and you have a small wound on your leg and then you got your boot that has wound drainage from it in there, and that's all bacteria, you go and boom, now you're injecting into your open wound bacteria and you're going to get a cellulitis infection. That's bad news. Cellulitis, for those of you who don't know, is an infection in the limb. You'll look down there and look at your leg and say, oh, I got a big red spot. You'll go to touch it and go, ooh, ow, that hurts. And it's very hot, like you got a fever going on in your limb. This can happen in legs or arms. That's bad, because cellulitis, if you do nothing, has the potential to kill you. Thing is, it's easily treatable. If you see this happening with you right now, stop pumping. Call your doctor or nurse practitioner, tell them what your symptoms are. They should diagnose you quickly and say, yeah, that sounds just like cellulitis. Let me give you some antibiotics. You go on antibiotics for a week to 10 days. Let the doctor check you out to make sure you're clear. Then you can continue to pump. But there is no pumping during an infection. We don't want to take the infection from here, so pushing it up the limb into the rest of the body. But the upside here is using the pump every day diminishes the chance of getting cellulitis. Same thing goes for DVTs, deep vein thromboses, fancy medical term for a blood clot. They can form when you have lymphedema, and it's not a good thing. In the leg or the arm, they're going to hurt like hell. Problem is, they often don't stay in the limb that they form in. They'll break free and start floating about your body till it finds a vein or an artery too small and goes like a bathtub stopper, shutting off flow of blood to that area. If that area in your body happens to be your head, you're going to have a stroke. If it lands in your heart, you're going to have a heart attack. I know this from personal experience. So, pumping every day keeps the blood flow moving through the limbs, minimizes dramatically your chance for getting a DVT. So, in addition to helping keep the limb size down, it helps increase the circulation, minimizes chances for cellulitis, DVTs. Also, it's going to keep the leg from getting bigger or the arm from getting bigger. After 32 years, I've seen a lot of things. And I'll go to see people and, wow, that's a big leg. And I'll put them in the boots. A year or two later, I'll hear from them and they're like, hey, Dan, those boots you gave me, they done shrunk up on me. And I'm like, how does vinyl shrink exactly? And they're like, well, I don't know, I can't zip it up anymore. When I question them, I say, when's the last time you were actually in the boots? And the reply sometimes is, 6 months ago. And I'm like, okay, newsflash, the boots didn't get smaller, you got a lot bigger. And if you do nothing with lymphedema, you do stand a possibility of getting bigger, a lot bigger. I have had patients that have had ankles out to here, calves out to here, thighs out to here, and it just gets worse and worse for them the bigger they get. The pump will go a long way to keeping your limb size down, keeping the circulation up, and minimizing a lot of health problems. That's why it's important to do this every day and stay with the program, because otherwise it can get a lot worse. Now, as we see here, this is going up. Right now we're about halfway. It's filling up chamber 2, but I can feel there's a little bit of play in chambers 3 and 4. So now if we wanted to get out of this, would be not a good time. We want to let it finish filling up all the way to number 4. Then there'll be a slight whoosh in the machine. You'll feel the pressure dissipate, and it will go down, and then that will be the time to turn it off. Okay, we're filling up number 4 now, so we're just about there. So it fills up, it'll hold for a second, and then all of a sudden it'll go down. The patient will be able to feel it, and you'll see wrinkles appear in the boots, and then we're going to go ahead and press that green button, and we're going to turn it off. And there we go. It's going down. So at this point, you can see here the wrinkles appear. That's good. I'm going to take the green button right here, press down. She did have 49 minutes left, but we're pretty much covering everything. So we're just going to turn that. It's going to say end, off, and then it's going to go blank, and now we're done. If you have the luxury of sitting here for 5 minutes, let it sit for 5 minutes. More and more air will come out. It'll be a lot easier to take it off. But if you don't, just kind of lift off, and boom, it comes right off just like that. And then the boots we can unzip about halfway down, lift up, and now the patient is done. So that is it. That is how to use the Biocompression 2004 DL pump. Check my website for additional instructions and help, and feel free to call us at any time from the website. Thanks, and have a great day.